Hello, welcome everyone. So this is NMBF Coffee Chats, which is a Christian-based channel where we discuss about public awareness, where we host a lot of public awareness sessions. We do this in line with the calling that Jesus has asked us, that is to show His love to everyone around us. So, in keeping with that, today we have a special speaker, Dr. Tabassum, and she's going to be addressing one of the most important issues that women face throughout India, especially in India, which is in the breast cancer awareness. So I hope, please feel free. I think all of the participants, or most of them I can see, are mostly women, even if there are men. Please, I encourage you to listen the message and share it to your friends across, or at least you can share this live to everyone that you know, so that people are more aware. And please stay back, so all your questions will be answered towards the end once doctor's session is over. And please feel free to post your questions either to me directly or to doctor directly or in the public chat, whichever is comfortable for you. So here now we welcome Dr. Tabassum. So before that, we would like to introduce Dr. Uh, just a sec. Yeah, a few words about Dr. Tabassum. So she's professor and consultant radiation oncologist at ACTREC TMC Tata Memorial Center, Mumbai, India. Dr. Tabassum specializes in breast oncology at TMC Tata Memorial Hospital, Mumbai. She strongly believes in cancer prevention, health education for cancer awareness, and early cancer diagnosis. She has volunteered for numerous cancer awareness sessions for different cadres of the society. She has keen interest in health economics, breast cosmesis, survivorship, and quality of life. She has more than 70 publications to her credit in various peer review national and international journals. She is also a passionate teacher and academician. Hi, Doctor. We welcome you. Please take over the session.
Yeah, uh, thank you very much for your kind introduction, and thanks, Abhijit, for inviting me again to deliver this talk, which is in line. I mean, previous talk was on general awareness about cancer awareness, and now we will be specifically focusing on the breast cancer awareness. So we will be discussing about few facts and figures as well as the risk factors. I mean, which women are, who is more likely to get cancer, and what is the incidence, how to prevent breast cancer, and how is the treatment once cancer is diagnosed. So I would be sharing my screen, and I have a presentation through which I hope my screen is visible.
Yes.
Yes.
And yeah. So let us talk about breast cancer awareness. Prevention is better than cure. So this is the most important message which I want to give through this talk, that prevention is better than cure. So during a woman's lifetime, a lot of changes occur in her breast. And some of these changes are normal, while others are not. So let us first understand what the composition of breast is. So breast is nothing but a network of milk producing sacs. It These sacs lead to the ducts, which are the passageways for carrying milk. There is a supporting tissue, mainly in the form of fat, and lymph nodes and glands are there. There are tiny muscles which you can see the red in the red. So this is how is the composition of the breast, and what the cancer starts from is the lobules that are visible in the yellow, and this is the part of the breast where the cancer starts. So as there, the normal cell that looks like pink, but when there is alteration in the normal cell because of various mutations or genetic alterations that happen in the cell, the alterations accumulate, and finally it turns the normal cell into malignant cells or the cancer cell. And these cells lack the repair capacity, and hence they proliferate in an indefinite manner and out of control. So then it rapidly increases in size and it replaces the normal tissue in the body. So let us see how common is breast cancer in India. So as you can see, the first graph, the first figure shows the incidence of first most common cancers in males. The second one is of the females, and the third diagram is of uh, both males and females together. So if you see breast cancer, which is there in pink, the incidence is 26.6% in females, which means that almost one quarter of cancers that happen in female is the breast cancer, and it is the most common cancer. And if you have to look at the number of cases, close to around 2 lakh women every year develop breast cancer. And these are the latest figures of around 2022, and hence these are very alarming. I mean, these are the figures for India. And if you have to look at the incidence in across both males and females, it is still the most common cancer. As you can see, it is 13.6%. It is still the most common cancer, even if you consider males and females together. So this is a significant health problem in Indian women, and hence it is very important to know little more about how it develops and what are the ways in which we can prevent it. And it is equally important to also note that around 50% of cancers that develop or that the ladies present with at our hospital, these are early cancers, but significant number of women also develop locally advanced breast cancer, which means that they are having disease being diagnosed at an advanced stage, and hence the cure rates that is directly linked to the staging of cancer, the cure rates reduces. Hence the entire discussion for today is to become aware, so that you develop, even if anyone develops cancer, you pick it up at an early stage and not at a advanced stage, so that the cure rates are better. Let us talk about the risk factors of breast cancer, which means which are the factors that are present in our life that can be modified, or certain factors are there that are non-modifiable. So the non-modifiable factors include age, the gender. So being female itself is a risk factor, because women will have higher breast tissue because of the reproductive differences. Family history of breast cancer is also non-modifiable, because if any family member is having breast cancer and if it is genetic, then that is also a non-modifiable risk factor. The length of reproductive life, which means the age at which the menses are present and age at which the menses stop. So the length of the reproductive cycle life is determined by the age at which the periods start and the age at which the periods stop. So longer the life, reproductive life, higher is the risk of breast cancer. Then there are other risk factors, like there are certain benign breast conditions, which means there are conditions, the tumors that are not cancers, but they pose a little higher risk of developing into cancer in future if we do not follow them up. Then let us also see about the modifiable risk factors. So these are mainly the hormonal factors, that these include reproductive characteristics and the exogenous hormones and other lifestyle related factors. So let us talk about age and gender, which is the most important risk factor. So as you can see, as the age advances, the risk of developing cancer at 10 years also increases. So the highest risk is, I mean, at age 70 plus, where the development of 10-year risk of developing breast cancer is 4%. and the incidence is lesser in younger women. So generally, we assume the age of 40 as the definition for young breast cancer. So as you can see, the incidence is very less, just 1.5% at 10 years. And as I already mentioned, females have much more chance of developing breast cancer compared to the males. Now, coming to the family history, it is very important to note that 90% of breast cancers are not hereditary. Only 5 to 10% of breast cancers are hereditary. And what do I mean by this? It means that there are certain mutations that happen in the genes, and the most common mutations are the breast cancer 1 and breast cancer 2, that is the BRCA1 and the BRCA2 genes that is present in 20% of the familial breast cancers. So, who is at high risk of a breast cancer if there is a family history? So, there are certain conditions, like if there is one first degree relative with breast cancer or ovarian cancer, then there is an increased risk. If there are more than one first degree relatives with breast cancer, then the risk is even higher. A history of male breast cancer in the family is also increases the risk. Young age at onset, which I said, young age definition is age less than 40, and women having triple negative breast cancer. So, this is a type of breast cancer which we come to know when we do a biopsy. So, these are the risk factors when there is a positive family history. The other risk factors include race and ethnicity. So, whites and Jews are more commonly developed breast cancer. But if we have to talk about Indian ethnicity, then various mutations have been seen in Bohra community, in Kokanastha Brahmins, and in certain Punjabis also. So, when I was talking about the benign tumors or tumors that are not cancer, so there are certain conditions like the proliferative lesions with atopia. They also conquer the risk of developing or transforming into breast cancer. For women who have history of exposure to any radiation in the form of atomic bomb survivors, or any child who has received radiation in the past for childhood cancers, then they are also at risk of developing breast cancer in future. Coming to the hormonal factors, the reproductive characteristics means having periods younger than 12 years, having late menopause, which is more than 55 years of age. Nulliparity means not having children after marriage, late age at first pregnancy, beyond 35 years. And certain factors are protective, which means having age at a younger having child at a younger age, increased number of pregnancies, and also breastfeeding for 1 or 2 years. So these are the protective reproductive factors. And if anyone is consuming exogenous hormones either in the form of oral contraceptive pills, or it is more common in the West to take postmenopausal hormone replacement therapy. But this is not very common in India. So these exogenous hormones also increase the risk. Then we will see the lifestyle related factors, and these are the factors which we can very well control, because this is all a result of westernization of lifestyle. So most important is the obesity. So if the body mass index is more than 30, it increases the risk of many other cancers, and breast cancer is one of them. Then dietary factors, then micronutrient deficiencies, alcohol intake, and lack of exercise. Also, higher economic status indirectly leads to higher risk of breast cancer, because these problems of obesity, lack of exercise, alcohol intake are more frequently seen. So now let us talk about screening. So what is screening? It is to detect disease among healthy population without symptoms of disease. So it is doing some test in a healthy a healthy man or a woman, and they are not having any symptoms of disease. So detecting disease in healthy population is what is called screening. So when we have to talk about breast cancer, it can be done with the help of three tests. One is breast self-examination, second is clinical breast examination, and third is mammography. So I will explain about these tests in detail now. So coming to mammography, as you can see in the image, there is the breast is compressed between two plates of this mammography machine, and with this compression, if we are the radiologist is able to see the breast very clearly. So it is generally effective in postmenopausal women or women who have had their period stop. In India, the average age at diagnosis is younger than 50 years. Hence, we do not very strongly recommend mammographic screening in our population. And what we recommend is breast self-examination or the clinical breast examination as the best methods for early detection. And there are several other disadvantages of mammography because if you undergo a it is nothing but an breast X-ray. If there is any false negative or a false positive result, then it leads to unnecessary discomfort and anxiety due to overdiagnosis issues. So let us see how breast self-examination is done. It is a simple, cheap, and excellent method of awareness. So it starts with inspection of the breast. With your hands over the waist, behind the head, and also by palpating or examining your armpit with your hands. So this examination can be done can is ideally, or it is good to do it in say sleeping position, in the supine position. So as you can see that this picture which is showing the hand. So with the help of the three fingers having the dots, you have to make a flat of the hand, and with the help of this you have to start examining the breast. So you can choose the direction. Either you can choose the direction superior to inferior, or you can choose a clockwise or an anti-clockwise direction. So you have to start with the outer circle and then an inner circle near the nipple and the areola, so that you have examined the entire breast. No part of the breast is left unexamined. So this has to be done every month. And after examining the breast, it is also important to examine the armpit. So what you gain by this? You come to know what how your normal breast feels, how it looks, and if there are any changes, you will be able to readily or immediately know that there are certain changes that are not normal, and you should then consult a physician in case of concerns. So as I already explained, you can either choose a clockwise or an anti-clockwise superior inferior direction, and also examine the armpit for any swelling. And at the end, do not forget to also pinch the nipple at the base, so that if there is any abnormal discharge, generally a blood pinch discharge is considered abnormal, and any other color, white, milky, or greenish color discharge is not a warning sign of cancer. So this is how breast cancer presents. Symptoms due to primary. Primary means the lump in the breast. So either there will be a lump, or it can lead to dimpling. The lump will not be visible from outside, but it can lead to skin dimpling, or certain changes in the color or the texture of the overlying skin. Or it can it can lead to a bloody fluid that leaks out of the nipple. Or it can also present in the change in the size of the shape of the breast or the position of the nipple. So this is how the symptoms will be there from the breast lump. Then also symptoms due to axillary lymph nodes means there could be some swelling in the armpit, and it can be visible either in the form of a lump, or there might be some swelling in your upper arm. So that can also lead to swelling or pain in your upper limb. If the disease has spread beyond the armpit, then there can be symptoms due to spread either to the bones, and there could be bone pain, fracture, or some. If there is some spread in the lungs, then it can manifest as breathlessness, difficulty in breathing, or cough. And if there is something in the abdomen, in the liver, then it can lead to pain in abdomen, or it can present as jaundice or severe inability to eat, or anorexia and weight loss. So, once there is any suspected case of breast cancer, what we do triple test, and it comprises of clinical examination, bilateral mammography, and histopathological confirmation. So, once a diagnosis is to be made, once the cancer is suspected, then it is very important to do bilateral mammography. But for healthy women, we do not very strongly recommend mammography, but we recommend breast self-examination. And in a suspected case, we have to carry out all these three tests. So, as I already explained in mammography, each breast is compressed horizontally and then obliquely, and X-ray is taken in each position. So, this is nothing but an X-ray of the breast. Coming to the tissue diagnosis, so either it can be in the form of a fine needle aspiration cytology, which means we just inject a small syringe inside the lump and draw a fluid out of it. And that also can give us a confirmation of the cancer diagnosis. The more important method of confirmation is the biopsy, because we are not interested in just diagnosing cancer, but we also want to know what type of cancer it is, because that helps to decide us the treatment. So we want more detailed information. Hence, a small tissue is removed from the breast lump with the help of this needle, and that is sent for pathological confirmation. What is clinical examination is the examination by an expert, by a physician. So the physician will also examine all parts of the breast, as well as the armpit and the lower part of the neck near the collarbone. And in this way, the physician is able to know how much the cancer has spread. And in a medical term, we called this as the staging of breast cancer. What is the stage of breast cancer? Most common stages are from stage 1 to stage 4. So the stage 4 is not curable. Stage 1 is highly curable. So how this cancer spreads? So as you can see in the first figure, the big one, it is a very well-defined lump. But in the second figure, it grows and it infiltrates the normal ductal. I mean, the breast tissues. The yellow tissue is being infiltrated by the pink tumor, and as the lump also increases further in size, you can see the green lymph vessel is having the small cancer cells. And in this way, this then enters into the blood circulation. And in this way, the spread happens to the other parts of the body. So the most commonly involved are the bones, the lungs, and the liver. Uh, the metastasis to the brain occurs very late in the course. So what is generally recommended is the consultation should be done promptly if there is a lump, and if the changes persist after one menstrual cycle, or they change the appearance of the breast, then it has to be evaluated promptly. And any new signs or symptoms have to be taken note of, and immediately consultation with the oncologist. So if you see, the cure rates are almost 95 to 100% in stage 0 and stage 1, and it is very less cure rate up to 20% in stage 4. So higher the stage, the cure rates reduce. That's why it is important to detect the cancer at an early stage, and this is the intention of screening, or the aim of screening. So let us now talk about the screening recommendations. So the current guidelines that are broadly, I mean, followed are from US. And recently, in last year, they revised the recommendation guidelines for mammography. And till now, they used to advise that mammography should be done once in 2 years. Biennial means every 2 years for women aged 50 and above. But recently, last year, they updated all the information, medical information that was available in the form of a systematic review. And they then concluded that even for women in 40 to 50 years of age, there is benefit of mammography. And in women more than 75 years, there is no role of doing mammography. And hence, they have reduced the age cutoff for starting mammographic screening. And now they recommend it at the age of 40 and above. However, in India, as I already mentioned, we rely more on clinical breast examination, and this is based on a very large study that was done from Tata Hospital. And in this, what was done? This was a 20-year study. In this, clinical breast examination was conducted by trained female health workers in Mumbai. This trial was done in Mumbai itself, and what they saw was, because of the breast clinical breast examination, the development of tumor that happened in women, it reduced the mortality by 30%. And there was 5% reduction in all-cause mortality in was seen in the screening arm compared to the no screening arm. And hence it is widely recommended. However, this benefit was more again for women more than 50 years. As you can see the graph on the left-hand side, the difference in the pink line and the blue line was greatest in the women who were more than 50 years. So this was a very positive study, and hence clinical breast examination is very strongly recommended for Indian women. So if we have to also talk about other preventive factors, we know, as I already mentioned, that obesity, alcohol consumption, and poor nutrition and physical inactivity. These are the three factors that lead to 20% of all cancers in the body. And there are possible strategies for risk reduction, and this is to avoid delayed pregnancy, avoid long-term use of oral contraceptive pills, and avoid adult weight gain. Recommended strongly is breastfeeding for 1 or 2 years, and also include a healthy balanced diet inclusive of fruits and vegetables, and more than 3 hours of physical activity in a week is recommended. And of course, I need not I mean say the that limiting alcohol and smoking is also very important. So this is how the same things are depicted over here, the importance of physical activity and the importance of balanced diet. So cure is possible when it is detected at an early stage, as I already showed you the cure rates, and it is a multidisciplinary management. So what does that mean? No, only one doctor or a surgeon or a chemotherapy doctor cannot alone is sufficient for treatment of breast cancer. It includes a team of doctors, and these are surgeons, the medical oncologists, the physicians or experts who give chemotherapy and hormone therapy, radiation oncologists who give the radiation to the breast to avoid the future chance of recurrence, and also breast pathologist, the doctor that confirms the diagnosis, and the radiologist who read the mammography. These are also very important pillars of management. And after the surgery, it is also important to undergo physiotherapy, because as the breast surgery involves the removal of the lymph node, there is a high chance of lymphedema, which means development of arm edema, or the swelling of your upper limb because of surgery. So in order to overcome these side effects, it is important to consult a physiotherapist and a nutritionist. So this is how a cancer team or the multidisciplinary tumor board is done. And All the cases are discussed, and according to the stage, each doctor decides the treatment for chemotherapy, surgery, and radiotherapy. For technically, all patients do require all these modalities of treatment. Surgery is nothing but removal of the lump. As you can see in the first diagram, lumpectomy means only the lump is removed. But in women in whom the cancer is advanced, it is not possible to do a small surgery, and hence the removal of the breast is recommended. And it is important to undergo to advise surgery followed by radiation therapy, because it is important to give control. If this is not done, surgery and radiation is not done, the disease comes back again. And the middle diagram, you can see that the patient is taking chemotherapy in a daycare ward, and it helps to control local as well as distant disease. Distance means because it is given in the blood, it also controls the disease that is beyond the breast, so that there is a possibility of long term cure. Radiotherapy is nothing but in treatment with the X-rays, and it again controls the local disease. It has least side effects, and the duration can range from 1 to 4 weeks. It is given on a daily basis. Hence, to conclude, I would say, if you educate a man, you educate a single person, but if you educate a woman, you educate a generation. Hence, it is very important for women to be self-aware and also help other women to become health conscious and pay attention to